So back pain is not sciatica. They're two massively different things. Back pain is just back pain. Sciatica is a pinched nerve in the back or the buttock sending pain down through the leg. That's the difference. Now, if you've not got pain shooting down the leg, like most people don't, you've not got sciatica. So firstly, stop calling it sciatica. We're gonna fix your back pain today, and that is so common. Pain here, down through here. Now, most people with their back pain, they've got pain here and coming round to the side very often. And when that's the case, most of the time, you've got a tight QL and quadratus lumborum and erector spinae muscle, basically the muscles down through here. And you know this is the case because when you bend over like this, that muscle feels tight and it actually stretches. And because it's tight and painful, you're going to get pain increasing in there. And then even more than that, if you bend like that over to the side with a bit of a twist, you're going to find that is really sore in there. So we know that you've got that tight muscle. We know that's causing most of your symptoms. And what I'm going to do today is I'm going to show you 3 stunningly effective exercises that can reduce that tightness, reduce the pain, and get you feeling and moving back to your very best. And then once you are feeling better, you do the exercises once a week, once every 2 weeks, and you'll keep your back pain away. So just to run through the muscle that we're specifically talking about, your pelvis is there around that belt line, and your ribs are there higher up. Now, in between there and there, you've got the QL muscle, quadratus lumborum. It's a muscle deep in through there, and the erector spinae muscle runs down through the area as well. That's painful. If you get your thumb and press into the area, you will definitely feel it's tight and painful. So you press in, it feels painful, and that's exactly what we're targeting. First exercise, what I want you to do is, let's say that this here, the left side, in fact, no, I can do it this way. So the right side is the painful area. Lie on your bed, on your side, like this, and then have this leg hang off the back and drop down. What you'll find is, if you do that, your back will curl like this. And as you do that, you're feeling a deep stretch in through that area there, and you simply just lie there like that. Now that's one way of doing it. Potentially a more simple way, I'm going to show you now against that wall. I'm going to stand next to a wall with the painful side facing the wall. Place this leg back and then lean your shoulder into the wall and then push your hips in that way there. As you do this, I feel a really deep stretch all through there. So you're here, you're pushing your hips in and you feel a massively deep stretch deep into this area, and you just hold it there for a minute, maybe even 2 minutes if you can. That is tipping over, stretching right through that muscle, and that tight, painful muscle will get a deep stretch. And if you can do that 3, 4, 5 times a day, you're going to feel a massive release in this area, which is exactly what we want. So we've created a deep stretch in this area, which is a really easy way to release that tightness. Another thing we need to do is strengthen the muscle, and the way we do that is this. I want you to lie on your side. Lie on your side with the painful side up, and then lift this leg as high as you can. As you do that, the muscle through here is contracting to pull up. High as you can, hold for a second, and then lower. And again, high as you can, all the way up, hold, and lower. You're going to do that 4 or 5 times, as high as you can, and then rest 10 seconds, and then go again, all the way up, high as you can, and down. Do that for 3 sets. So if we're doing, let's say, 5 reps and resting, 5 reps resting, 5 reps resting, that's about 15 reps in total, contracting that muscle all through there. This exercise can be done just once a day, but the stretch, of course, is being done 3 times every single day. Now, the third thing that we really need to run through, which is potentially the most important thing, is how are we going to stop this problem from coming back over and over again? I've given you great exercises to release the tightness, an exercise to strengthen the muscle and get more blood flow and healing back into the area. Let's now run through the way we're going to stop this problem from reoccurring over and over again, because there's no point taking 2 steps forward with the exercises if you're going to take 2 steps backwards, because you're going to aggravate the problem again and again. What we're going to do, we're going to take 2 steps forwards, we're going to eliminate the problem that's causing it, and then you're going to take another 2 steps forward. So you're continually moving forwards. Basically, what I want you to do is think about this curve in here in your lower back. So when you're sat in your car, you're going to push your bum to the back of the chair and sit yourself upright. So your back curves inwards there. You're driving like this with your back curved like this, and that takes a lot of pressure away from this area, which is perfect, and it's exactly what we want. If you slouch forwards and you're like this all day, you're slouching your lower back, putting pressure into the discs, the joints, and the muscles. That is causing more and more aggravation and problems. So driving like that, not good. Push your bum to the back of the chair, sit upright. That's what we want. The next thing I want you to really focus on is when you're bending forwards, do not round your back like this, because that puts huge pressure into the area, aggravating it over and over again. We have a curve going in. Maintain that when you bend forwards by doing this. So push your bum to the back like that as you bend forward. So if you're doing a teeth over a sink there, you're pushing bum back and there. If you're going into a cupboard, push your bum back to there. Don't round over, do your teeth. That is the worst thing you can do. The worst thing also actually is just staying in that position, because that's always going to cause problems in your back. Those are the three things. We need to make sure that we are stretching out that tight muscle, strengthening the tight muscle, and also bending and moving the right way. If you do that, you're going to start to feel the move so much better, almost guaranteed. Now, is it going to totally fix your problem? I hope so. If it doesn't, you need to look at the other exercises on my channel. I've got loads of videos, loads of little short videos and longer videos for you. And make sure you watch them, make sure you like, subscribe. I've got so many more videos coming your way. Comment down below if you've got any questions. I'll be there to help you.